Tracheostomy Care. Check PCP orders. Gather supplies and equipment. Perform hand hygiene and maintain standard precautions. Introduce self.
Hi, my name's Sarah. I'm going to be your student nurse today.
Provide for privacy.
I'm going to go ahead and shut your door for some privacy.
Identify the patient using 2 identifiers.
Can you go ahead and tell me your name and your date of birth?
Have the patient state their name and date of birth as you verify information with the armband.
Great. Thank you, Ms. Roberts.
Check for allergies.
Do you have any allergies?
And explain the procedure to the patient.
So I'm going to be performing some tracheostomy care today. So what that means is I'm going to remove the old dressing and the old inner cannula, put on a new dressing after I clean the area, and then I'll also put in a new inner cannula and a new tracheostomy collar. Do you have any questions about that?
Ensure that all emergency equipment is within reach, including the obturator. Don clean gloves and apply proper PPE. Raise the bed to working height and lower the side rails as appropriate and safe. Assess tracheostomy for placement and patient for respiratory status.
I'm just going to check your pulse ox status. You can put this on your finger. All right. I just need to take a quick listen to your lungs. Just going to move your gown out of the way, okay? And take a deep breath for me. And again. And again. One more time. Okay, thank you.
Place ambu bag at head of bed and ensure it is operational and has 100% oxygen airflow. Place biohazard bag within reach. Remove tracheostomy dressing and discard per facility policy.
I'm going to take your oxygen off so I can get to that dressing. Remove your dressing now.
Assess tracheostomy site. Remove and dispose of gloves and perform hand hygiene. Open sterile tracheostomy kit, maintaining aseptic technique. Fill sterile saline container with sterile saline. Apply clean gloves. Remove inner cannula.
All right, I'm just going to remove the inner cannula.
Stabilize faceplate with one hand. Twist inner cannula to unlock it. Pull the inner cannula up and out and dispose of inner cannula per facility policy. Remove and dispose of gloves and perform hand hygiene. Prepare remainder of supplies from kit. Don sterile gloves. Using sterile hand, cleanse site with sterile cotton ball or swabs. Use the clean hand to stabilize the tracheostomy. Dip sterile cotton swab in saline solution and use a new swab for each swipe. Gently cleanse outer area of tracheostomy. Cleanse from the stoma outward. Pat outer area of tracheostomy dry with sterile gauze. Insert new inner cannula. Use dominant hand to position inner cannula properly over tracheostomy. Twist inner cannula to lock into place. Apply bifurcated or folded 4x4 gauze to tracheostomy site. Gently lift one side of the faceplate to insert the gauze and then repeat on the other side. Change Velcro tracheostomy tube holder. Secure new holder. Do not remove the old holder. Place holder around back of patient's neck and insert the ends of the holder in the faceplate to secure. Secure new holder before removing old holder. Remove and dispose of gloves and perform hand hygiene. Assess patient's respiratory status following the procedure.
Ms. Roberts, I'm going to reattach your oxygen and then I'm going to check your pulse ox again, okay? So I'm going to put this back on your finger. All right, we're good. I'm going to take another listen to your lungs real quick. Take some deep breaths for me. And again. One more time. Okay.
Return the bed to its lowest position. Raise the side rails. And verify that the call line is within reach. Don't clean gloves. Dispose of supplies. And properly dispose of PPE. Perform hand hygiene. Educate the patient. Instruct the patient to inform staff of respiratory needs, including need for additional suctioning or tracheostomy care.
All right, Ms. Roberts, if you feel the need for any additional suctioning, just be sure to let us know. If you feel any shortness of breath or anything like that, let us know, okay?
Document procedure, including the date, time, assessment, procedure, and patient's response to the procedure.